Welcome back. It's great to have you with us on SABC's Prime News. Looking tonight at the dreaded disease carried by mosquitoes. The African continent continues to bear an estimated 90%, if you can believe, of all malaria cases across the world and 90% of the deaths. According to the World Health Organization's malaria report released last week, progress has stalled. This comes after years of unprecedented global success in controlling malaria. Last year, there were an estimated 5 million more malaria cases globally, and officials are at a crossroads in their response. To discuss, we're joined by the World Health Organization National Program Officer, Anne Groepe. Thank you for being with us, Ms. Groepe. Why has the fight against malaria stalled?
Well, thank you first of all, and good evening to the viewers. I think it's very important to note that globally we've been moving fast along the way, made a lot of successes, but recently from the data that we've received for this year's report, we have seen that, we're not doing much better. And I think it's very difficult to identify exactly what the problems are because every country is so different. But in fact, we've identified issues of maybe funding gaps, looking at the insufficient funding, I think the gaps in the prevention that we do, interventions, and then again also sometimes the climate-related variations. And I think it's very important that this, for instance, this year has given us a bit of a wake-up call now, so we know that we need to do a bit more research and more interventions and try and find out a lot more about what is actually stalling this progress that we've been doing so well at in the past couple of years.
Can you elaborate on the picture? 5 million more cases globally last year, so that's causing an alarm. What sort of death rate and where are the major hotspots in Africa right now?
I think, yes, we've got 5 million more cases. I think the main areas that we look at, especially on our continent, as you said, 90% of the cases, and about 27% of those cases come from Nigeria, for instance. We've got another about 10% coming from the Democratic Republic of Congo. And then we have countries like Mozambique, we've got Mali, we've got Uganda, and then also other countries that was a little bit less, about 4% or 3% of the cases. So that really makes up quite a large amount of cases. Actually, in fact, the only other country that has large number of cases outside of South Africa and outside of our region is India. And together with India, Burkina Faso and Nigeria, they make up about 58% of the cases in the world.
So
but the deaths we see hasn't changed as much.
Yeah, well, we're showing a map on screen, Ms. Groepe, which I think presumably the red part covering Nigeria, things like that, showing the real hotspots. How does South Africa fit into this? I was surprised a few months ago when there was an outbreak here.
Yes, I mean, South Africa is one of the countries actually that has been geared in towards looking at malaria elimination. And South Africa, together with other countries in the SADC region, have actually been experiencing an increase in the malaria cases. Again, it's also one of the things that we haven't been able to really pinpoint exactly why. In some cases, obviously, it's looking at the interventions and whether the interventions coverage rate is quite high enough. Because once you start doing interventions, your coverage of that intervention, whether it is using of bed nets or whether we're using indoor residual spraying, you must reach a coverage of at least 80% in order to make sure that the people are protected from the disease. And I think one of the things we've been seeing is that there's been a decrease in the interventions, such as, for instance, indoor residual spraying. There's been a bit of a decrease, and this could be one of the reasons. And of course, also, as I said before, looking at the climatic variations can play a role as well.
On the decrease in interventions, could there be complacency? So you're talking about drugs or sprays or bed nets. Do people just stop seeing the real need for those sort of things?
I think it's not also just people, but I think, as I said before, the funding gaps have also made a lot of impact in the fact that once you start looking at your indoor residual spraying, because you have to alternate your chemicals, your insecticides, because you don't want to build up resistance, you end up having to look for a different insecticide that will cost a lot more. And in that case, then you can't really put your average coverage at 80% where you want it to be. And I think it's very similar. In a way also, people think that mosquito nets don't work. We've dished out quite a lot of mosquito nets, but so far the communities are still short of nets. So there's still like only a 43% coverage of nets. If you really want to reach 80%, then we really have to put a lot of money and effort into getting that to the communities.
Can the World Health Organization raise the funds needed, given so many priorities right now? And what about the funding for a vaccine, say?
Well, I think we need to look at the fact that we're looking at about 6.5 billion is what they would estimate we would need per year for all the interventions to really be in place and for the success to be able to come back. But also the issue is that from that, for this year, 2016, the last year, only about 2.7 billion US dollars was available for that. And so you could see there's been quite a cut in the funding so far. And if we don't reach, the 6.5 billion that we need, we could end up, having quite to go backtrack a lot more than what we're doing currently. As far as the vaccine goes, there's a vaccine that's been being tested currently, but for young children. And I think in the next year, we'd find that they would actually be using it in 3 countries, I think Ghana, Kenya, and Malawi. And it would be for young babies, as I said, 4 doses would be required. And the first dose would be at about 5 months. The second 2 and 3 dosage would be within monthly intervals. And the 4th dose would be just before the child reached about 2 years old. This is only for children at the moment. There's nothing for adults so far. And they've done quite a lot of trials on this already. And we're looking forward to seeing the success of this specific vaccine, especially for children.
That would be wonderful if it worked. Thank you so much for laying out the picture, which isn't great. The cases going up in Africa, in South Africa, not really sure why. But there from the World Health Organization, the National Program Officer, Anne Groepe, saying it could be linked to a decline in funds or a lack of funding to deal with malaria.